It was November 12th. I had a broken ankle, so I was off my feet for a month, and no energy. I mean, literally huffing and puffing. I'm thinking, my goodness, I'm out of condition all of a sudden. One day I just got to feeling a lot of pressure on my chest. When I stood up, I mean, you talk about dizzy. I was dizzy. And I told her, I says, call 911. Something is badly wrong here.
The classic symptoms of DVT would be swelling and pain in the legs. The symptoms of PE would be shortness of breath and chest pain that starts all of a sudden. These are very vague symptoms, but these are very telltale signs of somebody having a PE.
A DVT is a deep vein thrombosis, usually describes a blood clot in the pelvic or lower extremity veins. A pulmonary embolus, a PE, describes a blood clot that has embolized or migrated or traveled from one of the leg veins, say, into the heart and lungs.
I thought, heart attack. The EMT, she said, I think it's a blood clot. And as it turned out, she was right.
For the massive pulmonary embolus, the patient who is in extremis, who is not doing well right now, their mortality is very high. It's 25 to 50%. Oftentimes we worry overnight that patient's gonna be with us in the morning.
And I got to St. Agnes, and he says, the amount of clots that I had, that I might not be here. They didn't dilly-dally around. They got me prepped and started the procedure.
Hospitals across the country have started to develop pulmonary embolism response teams, or PERT teams, where multiple physicians from different specialties get together and try to decide what the best course of action is for a patient with a pulmonary embolus.
I'm very proud to say that our PERT program is the first program of such kind in Central Valley.
In the past several years, newer catheter-based technologies have come along that really have the ability to safely and effectively extract the blood clot from someone's lungs through a keyhole-size incision in the groin. And that has really changed the face of how we think about and treat pulmonary embolus.
It all began in, I think, January when I had a thyroidectomy, and then I noticed my ankle swelling. There was a lot of burning in my calf, back of my knee. I mean, I remember his story. He was in November, and I was thinking to myself, I'm too young to have a DVT.
It can happen in people of all ages, depending on the disease condition. And most of our patients do say the same thing, that I knew something was wrong. I couldn't just get comfortable.
A week later, I started noticing that it was getting hard to breathe. I had gotten up to go into the restroom and almost passed out. My husband said, I don't think this is right. Let's get you down to St. Agnes.
When she came to the hospital, a CAT scan was done showing large volume of clot in the blood vessels in both of her lungs. We offered her treatment with this sort of catheter-based technology, thrombectomy procedure. Turns out Teresa's father-in-law had been in the hospital with the same condition the year before and had had this same treatment and had done very well. The entire procedure is done through a small incision in the groin. A sheath is placed into the veins, and through that small tube, a second set of tubes is inserted through the sheath, and this is the tube through which the thrombus or blood clot is removed. Procedure takes usually about an hour, and when we're done, we remove the tube from the groin and a small stitch is placed at the groin.
It is documented nationally. There are a couple of studies that do show reduction in up to 90% mortality by using these devices.
After the procedure, you immediately feel like you could breathe again. I got back to my room and I was like, okay, that's what that's supposed to feel like. Had I not gone in and gotten it taken care of, they told me I had 24 to 36 hours to live. And Dr. Balfour was amazing. The whole team was fantastic.
Very much so, very much so. I mean, they got to taking care of business.
I love that St. Agnes offers this. This is all a huge blessing for me. It reminds you of your mortality, reminds you to listen to what your body's telling you. Pay attention, go to the doctor if you feel like something's not quite right. This team is amazing.
I couldn't ask for anything better. And as far as I'm concerned, they saved my life.